Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you for having me. Today I would like to present my community service activity with the title Improving Knowledge about Malocclusion and Detection of Malocclusion Classification. This community services is conducted by me, Tita Ratya Utari, my colleague Sultan Ardiansyah Bayu Ananda, Puspitari Nindia, and my student from School of Clinical Dentistry, Faculty of Dentistry, Universitas Muhammadiyah Yogyakarta. Malocclusion is described as an abnormal occlusion condition. Malocclusion ranks second in dental and oral health problem after caries in children and adolescents. The condition of teeth experience malocclusion, but the position of the teeth is generally irregular or crowded, can lead to several problems, including periodontal tissue damage, and also increase the risk of caries since it is difficult to clean crowded teeth properly. Frequently, malocclusion occurs most in adolescents with varying degrees of severity. So the purpose of this community services activity and collaboration with Indonesian Embassy School in Mecca, Saudi Arabia, is to improve the knowledge of the junior high school student by providing education and understanding about malocclusion, the impact on the dental and oral health, as well as its treatment and effort to maintain dental and oral health. Direct examination of students was not yet possible because it is required a lot of diagnostic equipment and difficulties in sterilizing the equipment, so students were directed to take intraoral photos of their teeth by pulling their right and left cheeks using 2 tablespoons. The photo from students were uploaded to the prepared Google Drive link, and in the Google Drive link, there are instructions on how to take intraoral photos of the teeth. Like in this picture, they already instruction how to take the photograph. The result obtained from 42 students, revealing that 27 students, 64.3% were angle in class 1 malocclusion, 11 students, 26.2% angle class 3 malocclusion, and 5 students, 9.5% angle class 3 malocclusion. And then a total of 15 questions were given to the participant before and after the presentation about education, which were the same question as indicator of the success of the activity. The result of the pre-test before the counseling and the post-test after the counseling can be seen in this figure, where there is an increase in the student knowledge. Like in this picture, in the red line is a post-test score. With t-test analysis, the p-value smaller than 0.05, so there is a significant difference between the pre-test and the post-test result. Knowledge about malocclusion will encourage better oral hygiene practice. Adolescents who understand the implication of malocclusion are also more likely to engage in proactive dental care, thereby reducing the risk of dental caries and other oral health problems. And understanding malocclusion and its potential complication can motivate adolescents to seek early treatment, preventing more severe dental problems and the need for more invasive procedure in the future. So as a conclusion, junior high school students of the Indonesian Embassy School in Mecca experienced a significant increase in their understanding and knowledge about malocclusion. And based on the classification of malocclusion, the most common condition experienced by students is angle class 1 malocclusion. So promotive and preventive efforts are therefore highly needed and effective in increasing knowledge of malocclusion and providing provision for adolescent students to overcome and prevent the negative effect caused by malocclusion teeth. So this is our program documentation, and all of the students is very participant, and we are very grateful because the activity is running very well. Thank you very much for your kind attention. UMY ada masyarakat berdaya. Wassalamualaikum warahmatullahi wabarakatuh.